Today, I want to talk about something that I believe sits underneath so much of what went wrong during COVID. We always talk about the shots, we argue about the mandates, we argue about early treatment, censorship, hospital policy, CDC guidance, all of it. But I think that the deeper issue most people are still not talking about is that there is a culture inside government health agencies. What happens when the people who shape public health are working inside a system built on hierarchy, career protection, protocol, and most of all, institutional loyalty? What happens when the people around you know something is wrong, but the cost of saying so feels way too high? And I want to tie that into a clip that I'll play here with Dr. Robert Malone, because whether you agree with everything he says or not, he said something that I think is worth paying attention to. That the people inside these systems can become deeply entrenched, and that speaking honestly about vaccine harms or pulling back legal protections like the PrEP Act was something that they did not want discussed. Those are his characterizations and allegations from the interview. And I'm just using them to frame a larger point about institutional pressure. I mean, not independently verify every allegation he made, but to speak from my own experience. What he said reminded me instantly of something my own boss told me during COVID. She said to me, as I went to her office, because I had gotten word that the nurses were conspiring to report me to the nursing board for talking about ivermectin. And she told me, Jodi, you work for the government. You have to follow policy and protocol. You can only talk about the medications that the physician ordered for the patient. And I said, that is so not true. I said, I have to follow the code of ethics, and it requires me to give patients all the information, especially if it's information that I know that I have been researching for over a year at this point. And that's the thing. Policy and protocol in the hospital is one thing, but we are compelled as nurses to continue our education. And just because one protocol they're using in the hospital doesn't mean that there weren't many other different protocols that were being used to treat COVID, for example. But before we get into it, I want to thank today's sponsor, which is West Cocoa Pharmacy and Compounding. That's cocopharmacy.com. This sponsorship, it actually means really something personal to me, because one of the things that I care deeply about is making sure that patients actually have access to treatment options and honest conversations. That's very personal for me, because during COVID, I saw firsthand what happened when a pharmacist who was a United States Public Health Service Commission Corps officer refused to move forward on ivermectin. She said that she could only dispense it for lice and scabies, not because it wasn't available, not because it wasn't safe, but that she was told that she would lose her job, and she's not willing to lose her job over this. And that moment really stuck with me, because it showed how much power can sit in the hands of someone who is choosing to follow the system instead of really looking at the patient in front of them. And that's why I appreciate West Cocoa Pharmacy and Compounding, because they really understand that real care means being willing to have conversations, explore options, and work alongside patients and providers who are looking for individualized support. They're also helping patients navigate a range of needs, including support for those dealing with cancer or other complex health challenges, because healing, guys, is not one size fits all. And at the end of the day, patients deserve access, compassion, and professionals that are willing to think beyond the mainstream protocols, right? So check out West Cocoa Pharmacy and Compounding and let them know that you heard about them on Nurses Out Loud. That is Cocoa Pharmacy, COCOA pharmacy.com. And say hi to my friend Nurse Donna, who's over there. She will speak to you guys for free. And so, yeah, I mean, most Americans, you probably never even heard of the United States Public Health Service Commission Corps officer that I just described. They People don't realize that they are one of the nation's uniformed services, and official USPHS materials describe it that way while also noting it is distinct from the armed forces and is unarmed. Officers serve across federal health settings in clinical, leadership, and regulatory roles. And that's the part that matters, because this is not just a loose connection of experts giving advice in a vacuum. This is structure, a hierarchy, a rank system, a promotion system, a retirement system, a career culture. And when your career is embedded in that kind of environment, dissent gets very expensive. And that is my point. Now, let me lay out a few numbers that caught my attention. The estimates I'm looking at suggest that approximately 32% of the USPHS Commission Corps officers are assigned to the CDC, NIH, and FDA. That is a big, 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 huge. That is a huge deal, because those are the three of the most influential health agencies in the country. And those same estimates put the Corps at roughly 6,000 to 6,500 active duty officers. And when you look at that rank structure, the estimates suggest roughly 40 to 42% are 0 to 5 and above. That is their rank. So this isn't just about staffing. This is about leadership concentration. This is about a significant number of senior people inside a rank-based culture helping shape public messaging, research priorities, vaccine recommendations, and policy direction. And once you understand that, it becomes easier to understand why so many people may have felt trapped, like my pharmacist, like maybe even her boss. And this is where I'm going to play the Malone clip real quick. And after the clip, I'm going to come back and talk about this, because whether you agree with Dr. Malone or not, I want you to hear the deeper point. He is describing a culture where people become entrenched, where people have culpability, where people do not want certain truths discussed, where professionals are expected to give thousands of hours and then be told what they can and cannot say. Again, these claims are from his own experience and perspective, but immediately when I heard it, I thought, yes, that's it. That's the exact kind of institutional culture I'm talking about. Because once truth becomes inconvenient for an institution, that institution starts protecting itself. And I saw it happen. I saw it happen in real time. You realize, guys, that these Commission Corps officers, they don't punch a clock, okay? They go where they are told. You find them a lot in leadership positions where they are acting director, right? Where, somebody gets removed out of it and they move them around. They move them around so nobody gets too comfortable in one place for too long, right? So you can't make too much change right there. And then all of a sudden one day they get orders and they have to leave. So let me play this, because I want you to understand how the patient is no longer at the center.
If you are a nurse that is fed up with the sick care model, I have a solution for you. My name is Melissa Schreitvatter, and I am the owner and founder of the Functional Nurse Academy. FNA is the most comprehensive functional medicine training program on the market, specifically tailored to nurses. It is self-paced and equips LPNs, RNs, and nurse practitioners to practice functional medicine, address the root causes of dysfunction, and start their independent functional medicine practices. At FNA, you will learn how to order labs, functional health reports, create customized wellness plans, package and price your services, and even how to market your brand effectively. Graduates earn 90 nursing CEUs, and then they qualify for multiple board certification titles. They also will have access to our exclusive tools, such as our functional nurse toolkit, our social media and marketing kit. And I don't want to just train you and send you on your way. So you also will get access to me each month via the Functional Nurse Academy monthly mentorship program, where you will be able to attend a live class with me each month. So say goodbye to sick care and start your dream career as a functional medicine nurse. Enroll today at functionalnurseacademy.com.
But is it still a hostile environment inside of these regulatory agencies and the government?
Del, it's guerrilla warfare. My comments to Bobby when he called me and asked me to stay on, and I said, no, I'm sorry, I've had enough. I don't think the CDC is redeemable. A lot of those people are very, very entrenched in the safe and effective narrative. And they also, many of these people, they have culpability, particularly as it relates to the COVID crisis in terms of suppression of information, manipulation of data. The people that are in there are the ones that have dirty hands. And Bobby's gotten rid of some of them. Now, there's something even worse, Del, that has been uncovered in all of this. I'm not going to name a name, but Bobby appointed somebody to be operationally in charge of the ACIP and a number of other aspects of the CDC. And that person appears to have been a mole. The word saboteur has been used.
Wow.
And I warned Bobby about it, but Bobby didn't think that was the case. But now it's come clear from that person's actions that they've done a lot of damage.
So why step down? I wanted you in there. We needed you in there. What made you come to this conclusion?
Yeah, this thing is a hot mess. It's not serving its function. It's really a fool's errand. We put thousands of hours. We're treated like chattel. The disrespect, frankly, from the government has just been longstanding and profound. This kind of, well, we're going to tell you what to say and when to say it. We don't want you to talk about vaccine harms, and we don't want you to recommend that the PrEP Act protection be pulled. They have never provided any cover for us with all these attacks that we've been sustaining. These people have been run through the ringer. They've lost grants. They've been isolated professionally. The government's attitude is basically we're expendable. You've got thousands of hours from 17 highly trained professionals who are taking time out from their practice. This is just absurd. I'm just done with it.
All right. So, I didn't hear that and think about it abstractly, because when I heard that, I immediately went back to my own experience inside Indian Health Service. Indian Health Service is a branch of the Health and Human Services. It's a federal branch that serves the Native Americans. And I was a civilian nurse, not a Commissioned Corps officer. But I was close enough to that system to see how it worked. And what I realized was this, that at my facility, the chief nursing officer, the chief medical officer, the head of pharmacy, the pharmacist, and the nurse managers in med-surg and the ED and not the ICU, but mainly most of them, even at the clinics, they were all part of the United States Commissioned Corps. And so these aren't temporary people. These are career public servants. These were people whose professional lives, benefits, promotions, retirement, and their identity are tied into the government structure. And that changes things, because when your whole future is wrapped up in that system, you don't just casually step out and challenge it, right? You calculate, you hesitate, you weigh the cost. You tell yourself maybe later. You tell yourself maybe after retirement. And I had one nurse say that to me while I was recording what was happening. because I had gotten to the point where I was like, I'm not going to change things. My boss, she even told me, she said, Jodi, people like you can do a lot of good in the government, but you just got to hang in there. And I was like, hang in there. People are being coerced into medical treatments. Their informed consent is gone. The right to an advocate is gone. We're pushing these experimental treatments and medical interventions without giving people the full information for them to make informed decisions. And the nurse on camera said that she wanted to blow the whistle, but she was not going to do it until she retired. I mean, guys, think about that. That one statement tells you everything. That concern is so real. And so is the cost of speaking it too. I mean, they're not the military, but it's the closest thing that I can get you to understand. I mean, you have the officers, right, that sign up, or, our military that sign up, and all of a sudden they get into this environment where they follow orders. And if you don't follow orders, you are going to be targeted, maybe even, hazed. That happens. I mean, and this is like one of the biggest points that I want to make, because silence doesn't always mean consensus. Silence sometimes means fear. It means career preservation. It means people know exactly what happens when you challenge the system. And this is especially true in institutions where removal is difficult, slow, and highly procedural. Federal personnel systems include formal adverse action and appeals process. That does not make removal impossible, but it can create a culture of inertia and protection. So I don't know if you've ever heard the phrase, it basically will take an act of Congress to fire a federal worker. And it's not because they're untouchable, but I would absolutely say this, that the system can be slow to discipline, slow to remove, and very protective of insiders. And when you combine that with pension, rank, promotion, and identity, you create a culture where many people will stay silent, even when they know better, because they think that they cannot stand up against the machine. And I'm telling you, it is a machine. And it is that for a reason, right? And this is where the nursing code of ethics, the lens, becomes so important, because when my boss told me, you're a government employee, you got to follow policy and protocol, I knew that that was not the highest standard. The highest standard is my ethical duty. And that's the difference. That policy is not the same thing as ethics. Protocol is not the same thing as conscience. Employment is not the same thing as moral obligation. And this is exactly why I keep teaching on the code of ethics, and why it's really hard, because nurses are often taught and providers, they're often taught the broad principles of bioethics, like do no harm, non-maleficence, benevolence, veracity, right? We're taught the principles, but they are not deeply formed in the code itself. So when a real crisis comes, many default to policy, protocol, chain of command, fear, job protection, instead of asking, what is my ethical duty here? One of the risks in any powerful system is that professionals become so embedded in the institution, so dependent on the institution, and so shaped by the institution that they stop clearly seeing when the institution itself is causing harm. And that is the risk of being institutionalized. Not just corruption, not just cowardice, institutionalization. And you become so acclimated to the rules of the system that we mistake compliance for ethics. We mistake professionalism for ethics. And once that happens, people can be participating in harm while still telling themselves they are doing their job. And that is dangerous, because if you do not know your ethical foundation before the crisis comes, you will likely default to institutional self-protection when the pressure hits. And that is what happens for most. I mean, for me, one of the clearest examples was ivermectin. I had a patient who was also my coworker who took the shot 2 weeks later, she had come in with a COVID diagnosis, okay? Which, side note, that is COVID-19 disease after vaccination was listed as an adverse event of special interest on VAERS, by the way. Not sure if that was documented or reported, but anyway, she wanted to try that stuff that I had been talking about. I had been talking about it for almost a year at that point, and a physician was willing to order it, and the pharmacist refused. And like I said, that pharmacist was a commissioned corps officer. And that moment said so much to me because when I found out that pharmacy blocked it, which was the exact words that her nurse told me, first I got a call saying the doctor's going to order it. And then I got a call a few minutes later, pharmacy blocked it. That's when I called the pharmacist into my office and I hit the record button on my cell phone. And that was the very first recording that I took because I was blown away. There was no contraindications for the patient. She was requesting it. The physician, from what the nurse said, was going to order it. And that moment said so much to me because it showed me how institutional power can sit in the hands of someone who is not first asking, what does this patient need? But instead, what is acceptable inside this system? And that right there, my friends, is the ethical problem. That is the dilemma. When patient options are filtered through bureaucracy, fear, political messaging, and institutional obedience, that patient is no longer the center of the care. The institution is. And that is one of the deepest failures of the COVID era. That right there is what keeps me motivated to teach ethics. And so, Righteous RN, I am a long-term provider where I can award CNEs, and I want to encourage you guys to go check out righteousrn.com because I do have the flagship course, Navigating Ethical Waters, a comprehensive approach to nursing ethics. And that is in a post-2020 world. It's an amazing course. I also do speaking, and I can create courses for your nursing students, for any nurse. So yeah, check that out, righteousrn.com. Because I don't want to relitigate COVID, but this is really understanding what kind of system we have. And when I heard Dr. Malone say that, it's a fruitless effort. And you can see how when you have 30 to 40% of people in these institutions that are institutionalized and they don't want to have, and they are culpable to all of this, of course they don't want it to get out there. So it's really hard, but we have to understand how institutional structure shapes the behavior, because if not, we are going to repeat the same pattern. It's going to be a different emergency, a different disease, a different administration, but the same pressure. And the public will be told that there is a consensus, but the insiders will know that there is doubt. And many people will remain silent because dissent is just too costly. And that is why ethics matters. That is why courage matters. And that is why nurses need to know the code. So when I ask why so many insiders stayed silent, I don't think the answer is just ignorance. The answer is pressure. The answer is structure. The answer is career dependency. And the answer is the risk of becoming so institutionalized that obedience start to replace ethics. And that is why I said what I said back then, and I would say it again now. I do not answer first to policy and protocol. I answer first to the code of ethics, because patients deserve better than a system that protects itself first. They deserve truth. They deserve for you to be courageous, and they deserve for professionals who are willing to stand even when it costs them. And that is why I will keep speaking. That is it. I also talk a lot about this too, and I want to throw that out there is, You know, my identity is in Christ, okay? I first identify as a follower of Yeshua, and then I'm a nurse, right? I'm also a mom and a friend and all of that. But first, I am a child of God. And second, I am a nurse. And so I say this a lot. The Bible guides the believer the way the code of ethics guides the nurse. So whether you come into Righteous RN and you take the courses, read the code of ethics, read the code of ethics, and read your Bible if that's what you're compelled to do. I hope I gave you guys some inspiration and courage on this show. Until next time, friends, be safe, be well, and God bless. Thank you for listening to Nurses Out Loud. Nurses are called by our code of ethics to keep learning, do the research, and lead with moral courage and integrity, especially as healthcare changes. Keep doing the next right thing, especially when it's hard. If this show resonated with you, please like, share, and follow. It boosts us up in the algorithm so more people can find us. Until next time, friends, be safe, be well, and God bless. And if this episode offers continuing education credit, check the show notes for the learning objectives, disclosures, and exactly how to earn your certificate.